Good evening, everyone. I am Dr. Surbhi, a psychiatrist and your moderator for tonight. Today, we will be basically talking about the urinary system. This show, as usual, has been brought to you by Evrox Healthcare, which is a health tech company. It basically has its digital app known as the Ev1 app, which is going to be launched very soon. And for the demos, you can contact us as soon as possible. All the doctors and the other healthcare workers who want to be recruited can contact us anytime on the given telephone number as well as the website address. So, today we are talking about the urinary system, which is very important in a way that it has been neglected for a very, very long time. So, when we talk about heart, when we talk about the brain, we are very, very serious about all these topics. But we aren't very serious about the kidneys or the ureters or the urinary bladder or the urethra as a whole system. So, today, to discuss the complications, the infections, and what might happen in this entire system, we have a urologist amongst us who works at the Hakim Sanaullah Specialist Hospital at Sopore in Kashmir. He is also a lecturer in urology at the Government Medical College, Srinagar, Kashmir. His interests are in the lower urinary tract disorders, chronic pelvic pain, and sexual health. Please welcome Dr. Omar.
Good evening. Hi, Surbhi. How are you?
I am wonderful. Thank you for asking. How are you doing?
Good. Cold, but otherwise fine.
Oh, yes, it's Kashmir. It has to be very cold there.
Yeah. We got an
Um,
early winter. It's an early winter now.
yeah. I live in the center of India, like the exact center of India, and the winter wave has already started here as well.
So is that Bhopal or
No,
Nagpur
it's
or where
Nagpur.
is?
Nagpur,
Okay,
yeah.
Nagpur. Okay,
Yeah.
nice.
Okay, so I think we should start the session, and soon Dr. Jeswani will be joining us.
Right.
So I think let's first begin with what I can say is like the generally asked questions by the common public are that how will they know that they have a kidney disease? Like what can be the symptoms, the signs that they can notice within themselves, which they can, then actually get referred to a specialist. So your comments,
Right.
please.
If it, now there are two main types of kidney diseases that we are talking about from the perspective of being a doctor and from the perspective of a patient. One are those types of kidney diseases which require surgery as a form of treatment, as an operation होना है patient का जिससे वो ठीक होगा. और the other type of kidney diseases are those जिनके लिए दवाई खानी पड़ती है. So the patient has to be alerted to the possibility, यानी कि उसको किडनी डिजीज हो सकता है अगर वो डायबिटिक हो और अगर उसको ब्लड प्रेशर की प्रॉब्लम हो. इन दो कंडीशंस में जो कि सबसे ज्यादा कॉमन वजह होती हैं किडनी फेल होने की, the most common causes of having chronic kidney disease are a patient being diabetic and hypertensive. So anyone who is diabetic and hypertensive, please at regular intervals, be it 6 months or at every year, अपने किडनीज की चेकअप कराइए. किडनी की चेकअप इज अ सिंपल ब्लड टेस्ट, अ सिंपल यूरिन टेस्ट एंड अ सिंपल अल्ट्रासाउंड. कोई उससे ज्यादा करने की जरूरत नहीं है. और अपने डॉक्टर साहब जो भी आपको ट्रीट कर रहे हो उन्हें आप दिखाएं. इट्स ऑल यू रिक्वायर. दोज आर द टाइप्स ऑफ डिजीजेस जो कि हिडन तरीके से आते हैं, वो छुपे आते हैं और आपको पता नहीं चलता है. अगर आप अपने ख्याल नहीं रखेंगे तो आपको पता नहीं चलेगा कि आपकी किडनी को डैमेज हो रही है. तो यू हैव टू बी ऑन रेगुलर वॉच. बाकी रहे वो किडनी डिजीजेस जो जिनके लिए सर्जरी जरूरत पड़ती है, जैसे कि किसी को किडनी स्टोन हो या गॉड फॉरबिड किसी को कैंसर हो, तो देयर प्रेजेंटेशन इज डिफरेंट. मोस्ट कॉमनली स्टोन का प्रेजेंटेशन होता है, माने पेशेंट को पेन होता है, एक तरफ से पेन होता है, यूरिन में ब्लड होता है, फीवर हो सकता है और ये पेन बार बार होता है. कभी कभी पेशेंट अपनी यूरिन के साथ स्टोन भी पास कर सकता है या पिछले 5-10 साल में एक आधा बार ऐसा उसके साथ हो रखा है. सो इन दोज कंडीशंस पेशेंट से कहना बहुत ज़रूरी है कि आप फिर से वही टेस्ट कराइए. यूरिन टेस्ट हो, एक सिंपल सा ब्लड टेस्ट हो और एक अपना अल्ट्रासाउंड कराइए और किसी भी अच्छे डॉक्टर साहब को दिखाइए ताकि पता तो चले कि ये दर्द के कारण क्या है, ये ब्लड जो आ रहा है आपके यूरिन में इसका कारण क्या है.
Right. Thank you. Thank you for that answer, Dr. Omar. So I just got a notification that Dr. Jeswani is here with us. So I think I'll introduce him also. So Dr. Jeswani is a nephrologist based in Nagpur. He works at the Nephron Hospital, which he has himself opened up in Nagpur. And let us welcome. He has also, studied his super specialization in the United Kingdom. Please welcome Dr. Jeswani.
Thank you, Dr. Survi. It is such an honor to be a part of this seminar. Hello, Dr. Omar.
Hi,
Sorry,
Dr.
I'm a bit
Jaswani.
late for this seminar.
No, how are you doing?
I'm
We
good.
keep
I'm good,
saying
sir.
we are the plumbers, but the nephrologists are the engineers.
Right, sir. Right.
Okay, so there is already a question flashing from Sanjeev Chakravarti. Is kidney the stepbrother of the major organs and is underrated as a vital organ? Uh,
Uh,
Anybody could take that question, please.
Dr.
Yeah,
I'll,
Jaswani.
Dr.
I'll
Jeswani.
Yeah, I'll probably take it. So yes, so I think kidney. I would say yes, definitely. A lot of times, I think there's a very lack of, I would say, awareness about kidney diseases. Now, for example, hypertension and diabetes. It's a lifestyle disorder. I would say kidney disease is also a lifestyle disorder now because you'll be surprised. Almost 50% of diabetic patients are actually having diabetic kidney disease in some form or the other, and there is so much of awareness about getting your blood pressure checked, getting your sugars checked, getting your heart screening done, a complete health checkup for the heart done, but there's actually no awareness about getting your kidneys checked. Actually, I think it is the most easy and the most cheap investigation to get a simple urine analysis, which can actually tell you a lot about your kidneys. So I think every disease in the form of the lifestyle disorders is actually affecting your kidneys. So definitely, I think yes, kidney is at the back seat at the moment, but more awareness is definitely required.
Yeah, and I also think more awareness is required because of the very fact that it is an end organ, just as our
True,
eyes. So if
true,
something
very
happens
true.
to the
Yes,
kidneys, yeah, yeah. So like the entire body can malfunction. Like one
that's
can go
true.
into
Yes,
multi-organ failure.
yeah, absolutely.
Yes. So speaking of which, like again, the commonest question that we have is urinary tract infections, UTIs. So, what are the signs and symptoms of a urinary tract infection, and what can one do to prevent UTIs?
Sorry, is it
Dr.
for me?
Omar, would you like to take the question
Okay, yeah.
or Dr. Jeswani?
So,
Yeah,
so
I think both
so
can,
I'll
collaborate and we can, yeah,
okay, fine.
go
So
ahead.
I'll take it up. I'll take it up, and then Dr. Jaswani can join in. So in terms of symptoms of UTI, patient will present with dysuria. He मतलब पेशाब में जलन जिसको बोलते हैं, बार बार पेशाब का आना, बहुत जोर से पेशाब का लगना, कभी कभी पेशाब का लीक होना, ये इनिशियल सिम्टम्स होते हैं. धीरे धीरे फिर अगर उसका ट्रीटमेंट ना लिया जाए, देन दे एंड अप विद फीवर, बुखार होना, फिर दर्द होना पेट के नीचे वाले हिस्से में या पेट के साइड के हिस्से में. कभी कभी ऐसे दर्द हो, दे कैन हैव पेन इन द लोअर एब्डोमेन और ऑन द साइड ऑफ द एब्डोमेन. So and then after that, if it is not treated, then they can have a high grade fever, and if again not treated, they usually become slightly drowsy, and they end up in the hospital with very in a bad condition, and they require intensive treatment at that. So my message to the viewers would be that when you have these symptoms, when थोड़ा सा भी पेशाब में जलन लगे, बुखार लगे, और आपको लगे कि पेशाब करने में या आने में थोड़ी सी तकलीफ हो रही है, just do like Dr. Jaswani said, a simple urine test, doesn't cost much, and show it to a good doctor who is accessible to you, and he or she will guide you what needs to be done after that. I'll hand over to Dr. Jaswani to add.
Yes, absolutely. I think I agree. Very simple symptoms. For example, जैसे सर ने बताया, यूरिन में जलन होना. A lot of times people have a history of elderly patients who come to us with symptoms of dysuria and hesitancy in the form of पेशाब रुक रुक के आना, पेशाब में जोर लगाना पड़ना. I think these are very early symptoms of having probably a UTI or rather a prostate infection. But there are a few things that probably you can do. If you know that you are prone for a recurrent UTI, or even for the matter of fact, a lot of females who come to us with a PID or a vaginal discharge, I think it is very important to visit to your gynecologist or have a early intervention done, because a lot of times our patients, elderly patients, are usually have comorbidities. They don't have one disease, usually are hypertensive, diabetic. They actually come to us with really bad complications. So I think definitely prevention of UTI, early picking up of symptoms is, I think, very important.
Yes, and while we are on the subject of, just as you broached upon, the like females have like higher chances of getting UTIs. So there is this question that crops up that why is it that women get UTI more often? Number one. Number two, honeymoon cystitis, as we know of. So why do women get UTIs, especially like the first time after having sexual intercourse? And what can women specifically do in a public setup to prevent UTIs? या लाइक जनरली बोलते हैं लड़कियों को या औरतों को कि आप प्लीज पब्लिक टॉयलेट्स ना यूज करें, तो पब्लिक में करना क्या होता है? सो ऑल दीज क्वेश्चंस.
So first of all, there's no doubt about the fact that getting a UTI, a woman is more prone, and it's the biological reason for that, because the last part of the urinary system, which is called the urethra, jahan se ki pishab bahar aata hai, that is shorter in a woman, and that in itself acts as a defense mechanism. So obviously, when the woman has a shorter urethra than the man, the chances of her getting a urinary tract infection are higher, because the bacteria can easily come from the skin or from the surrounding structures near where the urine comes out from, and they can come into the urinary system and colonize it. One of the best examples of that is, like you've alluded to, the honeymoon cystitis, is when the first time a woman has sexual intercourse, it is the first time that that area is undergoes a little bit of trauma by virtue of the act of having intercourse, and that trauma in itself introduces the organisms that are around that area into the urinary tract. Now, on its own, the urinary tract is sterile, माने उसके अंदर कोई जरासीम नहीं होता है. But once the first introduction of these microorganisms occurs, they have a nice sterile organ for it to colonize. And the first organ that comes in their path is the bladder. And that's why the inflammation of the bladder is called cystitis. And that's why the first organ to be infected, usually after the first intercourse, is the bladder. And the patients come with these things, complaints such as dysuria, painful urination, frequent urination, and sometimes, God forbid, they can even have blood in their urine because they have such a bad infection. Insofar as the prevention is concerned, we advise very simple things such as wiping yourself from a forward to backward location, so that the organisms that are around the place where one passes stools from do not come up towards the place where the urine is passed from, which is the urethra, the meatus, and keeping that area dry, and preferably having healthy sex practices, such as cleaning yourself after an act and maintaining sexual hygiene. I think Dr. Jaswani can also add.
Yes, absolutely. I think honeymoon cystitis is very well brought, Dr. Surbi. I think it is such a common encounter in our day-to-day practice. A lot of young females coming to us with complaints of these having recurrent UTI. I think what, as Sir rightly suggested, wiping the area from forward to backward is one. The other thing I suggest my patients a lot of time is simple acts of double winding. I have personally experienced in my practice, it kind of helps in double winding, as in when you void once and then you try to encourage the patient to void again. The other thing is definitely, I think education amongst the partners is very important, because a lot of times I think the male counterpart or the other part does not understand the gravity of the situation and how complex things may get. So definitely, I agree with sir. Absolutely.
Are commercial products like P Safe good to use for women while using public toilets? Can these help at all?
I defer to Dr. Jaswani.
Uh, P safe. So the thing is basically how it acts. It basically acts by altering the pH of your, I would say, the urethral meatus, and even for the matter of how the other vaginal pessaries and stuff work is basically they alter the pH of the wall, and thereby they inhibit the bacterial growth. Uh, Personally, I have not used much in my practice, but yes, literature does says that using these products can definitely lead to a decrease in bacterial colonization and UTIs. So I would say no harm, to be honest, in using these products.
I would recommend to any woman who experiences recurrent UTIs. In our definition, when we say recurrent UTIs, we see more than 2 in 6 months or 3 in a year. So if they're getting it once in 2 years or once in a year, we're not very worried about it. It's par for the course. But if they have like 3 times in a year, then they need to some form of additional treatment. And one of the very simple remedies that are available for women who are in a reproductive age group is just cranberry juice.
Yeah.
So it's something off the
Yeah.
shelf. You can take 3 glasses a day. You can carry it with you wherever you are and take it. It's very convenient. It's not so inedible. And if you're not happy with the juice, then you can take cranberry extracts in the form of some tablets. I'm sure Dr. Jaswani would agree with me.
Yes, absolutely. And I think I have actually seen a lot of patients doing very well on
Yeah,
cranberry extracts.
yeah,
They have actually the frequency, I would not say, I mean, the frequency has actually decreased of UTI.
yeah.
So definitely, and there is very good literature on cranberry
Yes,
extracts
yes,
affecting the
absolutely.
pH of your urinary bladder and the urine. So yes.
Yeah,
In fact, I think, uh, hello, Omar sir, lovely seeing you.
yeah. That's Dr. Day.
Yeah.
Hi, hope you're doing well.
So, what has come up also is like there are a lot of products that like women can spray on the seats of public toilets so that they are sanitized properly and that they are hygienic to use. Also, at the same time, nowadays there are some funnel shaped like products that have come up in which the women may stand while passing their urine.
Yeah,
So all these things can be used so that they don't have to touch the surface of the public
yeah,
toilets.
yeah,
So was just adding to both of your points.
Yeah.
That's
yeah.
all. So yeah, so I think UTIs have been covered quite properly for now, uh, like for the basic public awareness. So I think we should move on to kidney stones,
Okay,
like the next important topic that comes to mind are
okay.
kidney stones. So
Yeah.
yeah, so what would you like to talk about kidney stones?
Well, first of all, who is at risk for a kidney stone?
Yeah.
At risk for a kidney stone is somebody who in his family has somebody who has had a kidney stone. It's the same thing with like heart disease and diabetes and hypertension. So if you have had a family member who has had a kidney stone, not a bad idea to get an ultrasound done and visit a doctor. किसी डॉक्टर से मिल लीजिए कि फैमिली में किसी को किडनी स्टोन हुआ है तो मेरा क्या वर्कअप होना चाहिए. And I'm sure a good doctor would know the general workup that is required. Kidney stone न बनने के लिए what can you do? उसके लिए ये we say that there are three main things: low salt diet, low protein diet, and high intake of fluids. Because we have seen those patients who take high protein, specifically meat related proteins, those patients who take little less amount of water per day, and the range is 2.5 to 3 liters per 24 hours. So we say 2.5 liters is the bare minimum. And those patients who have a relatively higher salt intake in their fluid, in their food, they're the ones who are at a little higher risk of forming stones. Again, these are the two main things: diet and genetics. These are the things you cannot modify your genetics, but you can modify your diet. Now, there's another third reason which is very common in our population, and that is infection. So, like Dr. Jaswani said, if you have not treated your infection, like an old lady or an old man who has repeated UTIs and they're not paying attention to it, that in itself can lead to the formation of stones. So, again, for the general public, if you have minor urinary symptoms, get a simple urine test done, consult a nearby doctor, and I'm sure every doctor now is very well trained to pick up what a urinary tract infection is and to refer you to a proper doctor. I'm sure Dr. Jaswani will add.
Yes, so as you rightly said, hereditary. A lot of patients have these hereditary disorders wherein there is a defect in the channels in the kidneys, especially kids coming to us with hypocalciuric hypercalcemia, having kidney stones. So yes, rightly said, you can't change your heredity, but yes, you can change the diet. there's a specific area, I would say. For example, when I was doing my DM in Rajasthan, there's a specific belt of Sikar. In fact, even in Maharashtra, there's a specific belt near Amravati, which is very, very prone for kidney diseases, because I think probably the water content is such that these patients are more prone for stone formations. The other thing is that what we commonly get to ask, I think sir would agree with me, is patients come to us with stones, asking about alternative medications, asking about alternative therapies for stone remedies. To be honest, to be honest, I do not have personal experience on alternative medications, as much as I respect it. But I think a lot of times we do not know the content of the medicines, and a lot of people actually start consuming a lot of substances which are quite high in the amount of metal it has, and actually I've seen patients worsening with it. So kidney stone diseases, I think, is something. If you have a kidney stone, it is always better to get the correct treatment from the correct person. And having kidney disease can actually having kidney stones can actually have a long can have a very bad impact in the long run. So yeah, I think any more questions you want to hit about kidney stones, Dr. Mitra?
Yeah, so there is a question from Dr. Day. Are there any specific foods to avoid to prevent kidney stones?
uh, Avoid dietary meat, especially red meat. uh, Increase your fluid intake and take low salt diet. These are the three interventions in diet that have been proven to prevent the recurrence or the formation of kidney stones. And if somebody has kidney stones, it does not allow those kidney stones to increase in size. These are the three. The others are very vague remedies which have been suggested by multiple sources, but we only recommend these three.
Yeah, I
So is
totally
it
agree.
also important to take like low calcium or low phosphates in your diet?
Okay, now
Also,
so
is it?
there's a caveat there. Now there are some conditions in which kidney stones can form. Those people, like Dr. Jaswani said, they have hereditary problems, and they have what is known as hypercalciuria. It is of different types. Those patients we usually diagnose very early in their life, like Dr. Jaswani said, they're children or they're young adults, and we recommend to them, no, don't take a lot of calcium. People who are otherwise normal, like you and me, for example, have normal calcium metabolism, we do not recommend to them to lower their calcium, especially if they are adults beyond the age of 40 and 50, because they are already at a risk of bone thinning, which is called osteoporosis. So we don't want them to stop taking calcium, definitely not.
I would like to add, I think, Dr. Mitra, you should do a specific seminar on diet in kidney diseases. It is such a,
Yeah, true.
it is, I mean, I've really seen patients getting malnourished. Patients
Correct.
absolutely leaving everything, especially not just stone disease, patients of CKD who are actually not on dialysis. I've seen people stopping salt at all, zero salt in their diet, coming to us with hypertensive patients having actually hypotension. So yes, I think there's so many recommendations. If you Google it up, I mean, I think that it is very dangerous to Google up your diet. Rather, any symptom on Google is very, very dangerous. But if you Google it up, you will find you can't have green leafy vegetables, you can't have this, you can't have that. Then the patient can actually not take anything. And definitely, like sir rightly said, the cause of the kidney stone, for example, it is uric acid stone. Uric acid stones, you want to avoid nuts, you want to avoid chocolates. So I think it also depends on what type of kidney stones are we dealing with.
Yeah, actually, what you said is true. Like Google knowledge has become like WhatsApp University. So there are like so many people putting so many things on Google that it's not necessary that everything is going to be valid or everything is going to be research oriented. So it needs to come from like proper websites. So people need to understand that as well.
Yeah, so
So yeah,
WhatsApp University never gives a degree, and Dr. Google never does a surgery.
yes,
Yes.
yes. So yeah, so adding to your points about kidney disease, like my father, who was a diabetic as well as a hypertensive, he had both. So he started, like he started getting higher levels of creat in his blood and everything. So then later on, when we tried to find out like what's the real problem. So we obviously thought कि ये तो diabetic nephropathy निकलेगी या hypertensive nephropathy निकलेगी या दोनों का mixture निकलेगा, ऐसा कुछ तो होगा. Okay, something like that. But actually he fell sick earlier. And what we did is like, thankfully the nephrologist that we were showing, he said that you need to do a kidney biopsy. So he was like, फायदा क्या किडनी बायोप्सी करने का अगर डायबिटिक या हाइपरटेंसिव ही निकलने वाला है. But he got the rarest of the glomerulonephritis, that was autoimmune. And now that Dr. Jaswani was talking about all those products, you know, जिसमें toxins हो सकते हैं, metallic contents हो सकते हैं of a higher level. So ultimately, they do affect your kidneys in a very, very bad sense because ultimately the filtration happens there. So I just wanted to give a message to the public through this story that do not take कुछ भी because of the very fact कि उसमें कुछ भी रह सकता है. A lot of adulteration is there. And that can ultimately affect your kidney and cause an autoimmune reaction, which can ultimately start damaging your own organs. So please take care and like go to a proper doctor for that. Anyway, so yeah. So moving ahead with the kidney stones. So how do we treat those kidney stones then? How can they be treated? Once now ab ho chuke hai kidney stones. So ab aage kya?
So first of all, we have to understand a couple of things regarding kidney stones. Having a kidney stone means once if you have a kidney stones, you are at a high risk for developing a kidney stone again. The ratio is about 50% in 10 years. The only way you can stop yourself from having a kidney stone again is following the dietary recommendations that have been mentioned, or that if you have, God forbid, you're suffering from a disease like hypercalciuria, or you have, like Dr. Jaswani said, you have hyperuricosuriia, which is an increased uric acid level, you take the medications for that. Now once you have a kidney stone, the treatment depends on two major things. One is the size of the stone, and two is the site of the stone. So if you have a small kidney stone that is hidden in the kidney, गुर्दे के छोटे से कोने में बैठा हुआ 5 मिलीमीटर का एक छोटी सी पथरी है, अगर वो चुपचाप बैठा हुआ है तो उसके लिए कुछ नहीं करना है हमें. आप डाइट करें, आप अपनी ख्याल रखें, परहेज करें, एंड होपफुली दैट किडनी स्टोन विल आइदर पास विदाउट इंसिडेंट, or in some cases like in a uric acid stone, it can also dissolve. On the other hand, agar badi pathri hai and it is blocking somewhere, like the kidney has a ureter after that, which is from where the urine comes into the bladder, and if it is blocking that, even if it is a small stone of 3 mm or 4 millimeters, it then needs some sort of treatment. That treatment can be in the form of medications which will help push the stone out, or that treatment can be a small minor procedure which will help us to pull the stone out. And that minor procedure, 99% or more of the kidney stone related procedures or surgeries, as you call them, that are done today in any center are done with minimal access. मतलब कोई कट नहीं लगता है, आपको कोई कट नहीं लगता है, कोई incision नहीं लगता है, कोई चीरा नहीं लगता है, and the patient goes home the next day or the second day of surgery. And so all procedures are done without the patient even being aware that the procedure has been done. So it's risk free, it is very safe, and it is strongly recommended that once you have detected a kidney stone, see a good urologist, see a nephrologist. They will recommend the ideal treatment to you. And then of course, once you have the stone and it has been treated, follow the guidelines that your doctor has said कि आपको परहेज करना है, आपको पानी पीना है, आपको अपना सेहत का ख्याल रखना है, and you have to avoid certain foods.
Yes, Dr. Jaswani, would you like to
want
add?
to add I want to
Yeah,
add to
please.
common public कि भाइयों बहनों बियर पीने से स्टोन नहीं निकलता. I get a lot of questions coming कि मैंने 3 बियर मारी कल, मेरा स्टोन निकल गया. So basically what is the mechanism for it is that any alcohol content will actually cause natriuresis. It will cause more urine formation because of the osmosis. So basically हम क्या कर रहे हैं, हम फ्लश आउट करने की कोशिश कर रहे हैं, बट इसका मतलब ये नहीं कि हम उसके लिए जहर पी लें एक तरीके से. सो एज सर राइटली सेड, किडनी का साइज और किडनी की साइट बहुत ज़्यादा ज़रूरी है. यूजुअली 6-5 सेंटीमीटर से नीचे जो स्टोन्स होते हैं वो यूजुअली निकल जाते हैं. बाकी स्टोन्स में यू हैव टू ऑप्शंस, ईदर यू डिसॉल्व द स्टोन और ईदर यू रिमूव इट. Definitely I think getting the treatment from the right person is absolutely necessary, and no amount of alcohol can actually dissolve or remove your kidney stones.
Yeah, so no slow poisoning. Okay, thank you. Thank you, both of you, for that wonderful answer. So now that we were talking about this thing, like, stones, like the larger stones, blocking certain parts of the urinary tract system. So now it may either get blocked in the kidneys or in the ureters or in the urinary bladder or somewhere like down the urethra maybe. So now what happens is that it causes a lot of fluid to get deposited in your kidneys, like more and more, and they get dilated. So this we call as hydronephrosis. So now let's talk about hydronephrosis. What are the causes and how can it be prevented? How can it be treated? Also, yes, metastasis and a tumor can also cause the same thing, because obviously any kind of obstruction can cause hydronephrosis. So how do we go about it?
First of all, you have to understand, why did the patient come? Like, if somebody has got hydronephrosis, why did he come because of pain? Did he come because of blood and urine, or was he being worked up for something else? And also the age of the patient. In a young child, the cause of hydronephrosis will be different. Of any child with hydronephrosis needs a thorough workup by either a pediatric urologist, at least a pediatrician, and he needs to be managed very carefully with that, because hydronephrosis, any dilatation of the kidney in a child, is worrisome. On the other hand, if you have an adult, if somebody has just recently passed a stone and there is some residual hydronephrosis, I would not worry too much about it, provided there is no other stone anywhere else that's left. Other Some other causes, besides the stone causing the blockage of the ureter and the kidney, some other causes that worry me, as Dr. Mitra said, were metastases or cancer. Now, cancer causing hydronephrosis is possible, especially when it is cancer which is growing from elsewhere in the abdomen and which has blocked the ureter. And in that case, that patient can have hydronephrosis on one side, or in rare cases on both sides. Cancer of the kidney and of the ureters and of the bladder in itself can also cause hydronephrosis. In all these situations, it is strongly recommended that the patient sees a good doctor and sees them as soon as possible, because hydronephrosis is an alarming sign. It means your kidney is blocked. It means the kidney is not going to function properly until the blockage is removed. There are very rare conditions in which the hydronephrosis may be a normal thing, such as if a patient has taken a lot of fluid and has not yet cleared it. In that, sometimes we call that there is a pelvic ileal system fullness, but it's not exactly hydronephrosis. Also, sometimes some patients can have dilated kidneys by birth, and then at the age of 30 and 40 they have come for some investigation and they see that there is some hydronephrosis there. Again, see a good doctor. He will recommend what needs to be done next to treat it.
Yes, Dr. Jaswani, would you like
Yes,
to? Yeah.
definitely. I think hydronephrosis is the most alarming sign, I think, that you would encounter. So, as rightly said, hydronephrosis, if you have hydronephrosis, then definitely you need to do something about it. Rightly said, the type of hydronephrosis also varies. If it is mild, it can be just congenital. Sometimes it may not be harmful, but yes, any form of hydronephrosis which is causing any form of renal dysfunction in the form of, can actually impair the kidney function in the long run. uh, as Dr. Mitra, you asked about the treatment modalities. So a lot of times these patients do require some or the other form of surgical intervention, but I'm sure sir would be able to highlight better. But very simple procedures like putting a stent in, and probably by very simple techniques like putting a tube from the back called as a PCNL or a DJ stand can actually help you to resolve these problems. So hydronephrosis, yes, definitely is very alarming, and definitely you should seek the best advice and the expert advice for this.
Yes, I again have another story. I remember my grandmother. She had this cervical cancer, and after that, it had metastasized everywhere into her urinary system. So what happened was that she was not able to pass urine for a very, very long time, and she had like highly dilated kidneys, that is hydronephrosis. So ultimately, what happened is that no stent could be introduced from the lower tract, that is from the urethra. So ultimately, a stent had to be put directly into the kidney from the lumbar region,
Mhm.
and then she had a pouch, like a bag, hanging out of her body in which the urine was getting deposited.
Yep.
So yeah, that's also something that I'd seen. Okay. So I think moving ahead, if we talk about kidney disease, like in total, like CKD, especially like chronic kidney disease. So, like, what are the causes of a chronic kidney disorder, and what can the patient experience in this?
I'll take it probably.
Yeah.
Of
First,
course. Of course.
chronic kidney my domain.
Yeah, yeah, yeah.
So chronic kidney disease per se. So what is chronic kidney disease? Chronic kidney disease is structural or functional impairment of the kidney function for more than 3 months. That is the definition of chronic kidney disease. Now, if you talk about what can cause a chronic kidney disease, there is a long list. A lot of things can cause chronic kidney disease, but most common in India, I would say, is the lifestyle disorders, diabetes, and hypertension. You will be absolutely surprised to know almost 50% people of diabetes are actually having some form of diabetic kidney disease, and they're actually not aware about it. Diabetes, hypertension, the other most common cause of chronic kidney disease in India is stone disease as well. The other being some form of glomerulonephritis, like Dr. Mitra, you rightly said, although rare, but yes, it is a very common cause of chronic kidney disease as well. Chronic kidney disease per se can be also due to hereditary causes like hereditary focal segmental glomerulosclerosis, a polycystic kidney disease wherein multiple cysts are formed in the kidney, some hereditary disorders, rare hereditary disorders like Alport syndrome. So there's a long list. But yes, to mention, diabetes, hypertension, stone disease, and infections are very, very important causes in our country for chronic kidney disease. Now, if I say how can you know what are the symptoms, I would say there are very, very subtle symptoms which you can pick up for chronic kidney disease. Very simple symptoms. Patients who are having urinary problems, like the first thing to go in chronic kidney disease is, I think, the tubular function goes away. So patients actually have nocturia. Patients have a frequency of urination for 3 to 4 times at night because the tubular function of the kidney is lost first. The other thing is frothing in the urine. Pishab mein jhaag aana. Frothing in the urine is a sign of proteinuria. It indicates that the patient is leaking protein in some form in the urine. The other thing is having episodes of hematuria, repeated loin pains, dysuria, easy fatigability, decreased appetite, nausea in terms of uremic symptoms, and definitely patients, diabetic hypertensives having uncontrolled hypertension, uncontrolled diabetes are definitely more prone for chronic kidney disease. And chronic kidney disease is definitely fatal if it is not checked. And you'll be surprised to know after the age of 40, a normal person is losing 2 to 3% of his GFR normally. So if a patient is already having CKD, the rate of decline of GFR actually increases. So picking up CKD early is very important, and early intervention is also very, very important.
Yes. So, Dr. Jeswani, could you also explain what GFR and all that means? Because we are doing it for the common public, so
Yeah.
I don't think they would be able to understand what we are saying, like certain
So,
things.
yeah, so
Yeah.
GFR is basically what? GFR is glomerular filtration rate. GFR is basically how much of blood is being filtered by glomerulus is basically जो हमारी किडनी है, किडनी एक छन्नी की तरह, एक जैसे चाय की छन्नी आप इमेजिन कर सकते हैं, उसमें बहुत सारे छेद हैं, छोटे 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 छेद हैं. उसका एक जो फंक्शनल यूनिट है उसको नेफ्रॉन कहा जाता है. वो नेफ्रॉन में जो सबसे पहला जो सफाई करता है जो हिस्सा, उसको ग्लोमेरुलस कहते हैं. सो ग्लोमेरुलर फिल्ट्रेशन रेट इज नथिंग बट कि कितना ब्लड एक मिनट में फिल्टर होता है. एक नॉर्मल इंसान में द नॉर्मल जीएफआर इज मोर देन 90. दैट इज द नॉर्मल जीएफआर. एंड देन below 90, you stage it according to the GFR, according to the KDIGO guidelines. You stage it wherein a GFR of less than 15 is called as end stage renal failure, or a CKD stage 5.
Okay. Okay. So now the commonest question that comes after this CKD, like the chronic kidney disease, is the dialysis. Because ultimately, sometime or the other, these patients probably need dialysis in their lifetime. So then let's talk about that for, I think, in a proper segment, because it is a very, very important part. So, like, what is dialysis? How does it work? And why is it done in CKD patients? Also, there is a question from Rupa Ray Burman. Does insulin affect kidneys?
I'll quickly answer this. Does insulin affect kidney? So insulin affect kidney in the form of what? Basically, any drug that you are taking, it is getting metabolized in your body. So a lot of patients of CKD जिनको डायबिटीज होता है, आप देखोगे कि उनका इंसुलिन का रिक्वायरमेंट खत्म हो जाता है या उनका इंसुलिन का रिक्वायरमेंट एकदम से हाफ हो जाता है. The reason being that the half life of insulin in your body is actually increased. The kidneys cannot exceed. So if you're taking 8 units in your body, your kidneys unable to metabolize those 8 units, and those 8 units are actually staying in your body for a longer time. So insulin का इफेक्ट किडनी के ऊपर सिर्फ यही रहेगा कि आपका probably if you are having kidney disease, probably these patients have a decrease in the insulin requirement. This is actually a pseudo phenomenon. A lot of my patients actually come to me who have CKD saying कि सर मेरी तो शुगर ठीक हो गई, मेरा किडनी भी ठीक हो जाएगा क्योंकि शुगर के वजह से किडनी खराब हुई थी. देन आई हैव टू एक्सप्लेन इट टू देम दैट योर किडनी इज नॉट मेटाबोलाइजिंग एनी इंसुलिन, सो योर रिक्वायरमेंट फॉर इंसुलिन एक्चुअली गॉन डाउन. So it is a misnomer and it is actually a pseudo phenomenon. Moving on to dialysis. Now, why do you need dialysis? What is uh, when you have CKD? It is chronic kidney disease. Dialysis you can have also in acute kidney injury. Acute kidney injury मतलब जब कुछ ऐसा फिनोमिनन हुआ है कि कल परसों तक सब कुछ ठीक था और 1 या 2 दिन में किडनी के ऊपर असर आया और किडनी खराब हुई. Chronic kidney disease means, by definition, structural or functional impairment in renal function for more than 3 months. या फिर कुछ दिनों से या कुछ महीनों से कुछ ऐसा प्रॉब्लम हो रहा है किडनी में कि किडनी की प्रॉब्लम किडनी अपना सफाई करने का काम या पेशाब करने का काम नहीं कर पा रही है. सो व्हाट डू यू डू? यू नीड रीनल रिप्लेसमेंट थेरेपी. Now, what is renal replacement therapy? Renal replacement therapy is in the name. Renal replacement therapy. Now, it is an umbrella which has three things. Number one is kidney transplantation, number two is hemodialysis, and number three is peritoneal dialysis. डायलिसिस जो है, डायलिसिस दो तरीके के होते हैं. एक होता है खून का डायलिसिस और एक जिसको हम हीमोडायलिसिस कहते हैं, और एक होता है पेट का डायलिसिस जिसको हम हीमोडायलिसिस पेरिटोनियल डायलिसिस कहते हैं. हीमोडायलिसिस की अगर मैं बात करूं, हीमोडायलिसिस में हम क्या करते हैं कि बेसिकली हम किडनी जो अपना खून साफ करने का काम नहीं कर पा रही है, पूरा पेशाब बनाने का काम नहीं कर पा रही है, वो मशीन के द्वारा, एक आर्टिफिशियल मशीन के द्वारा हम वो किडनी का काम लेते हैं, जिसको हीमोडायलिसिस की प्रक्रिया कहा जाता है ना. हीमोडायलिसिस अक्यूट सेटिंग में भी लग सकता है, क्रॉनिक सेटिंग में भी लगता है, लेकिन अगर क्रॉनिक किडनी डिजीज को हीमोडायलिसिस लगता है तो ज्यादातर केसेस में ये लाइफ लॉन्ग डायलिसिस रहता है. लाइफ लॉन्ग क्यों? लाइफ लॉन्ग इसलिए क्योंकि एक नॉर्मल इंसान की किडनी 24 घंटे काम कर रही है, 7 दिन काम कर रही है. उस किडनी का काम हमें मशीन से लेना है कम से कम हफ्ते में 2 या 3 बार, 3 या 4 घंटे के लिए. तब जाके किडनी की सफाई होगी, तब जाके जो यूरिया क्रिएटिनिन की मात्रा बहुत ज्यादा बढ़ जाती है वो हम कम ला सकते हैं. तब जाके पेशेंट को भूख लगती है, पेशेंट को अच्छा लगता है, एक्स्ट्रा फ्लूइड जो है बॉडी का इट कम्स आउट, पैरों की स्वेलिंग चली जाती है. The other form of dialysis is called as peritoneal dialysis. Peritoneal dialysis is when आपके पेट के द्वारा डायलिसिस किया जाता है. जब आपके पेट की एक जो पेरिटोनियम की परत है उसी को एक आर्टिफिशियल मेम्ब्रेन की तरह यूज किया जाता है. एक ग्लूकोज रिच फ्लूइड एब्डोमेन के अंदर जाता है और फिर सोल्यूट्स एक्सचेंज होते हैं. पेरिटोनियल डायलिसिस के बहुत सारे फायदे हैं. पेरिटोनियल डायलिसिस आप अपने घर पे कर सकते हैं, आपको हॉस्पिटल जाने की जरूरत नहीं है, आप खुद पेरिटोनियल डायलिसिस कर सकते हैं. बट डेफिनेटली देयर आर सम शॉर्टकमिंग्स. पेरिटोनियल डायलिसिस थोड़ा कॉस्टली होता है, पेरिटोनियल डायलिसिस के लिए प्रॉपर ट्रेनिंग लगती है. अगर मैं हीमोडायलिसिस की बात करूं तो हीमोडायलिसिस के लिए पेशेंट को कम से कम हफ्ते में 2 या 3 बार हॉस्पिटल जाना पड़ता है. देयर इज ऑल्सो कॉन्सेप्ट ऑफ होम हीमोडायलिसिस विच इज वेरी प्रिविलेंट इन द वेस्टर्न वर्ल्ड. अनफॉर्चुनेटली फिलहाल इंडिया में उतना होम हीमोडायलिसिस प्रचलित नहीं है. But home hemodialysis is also possible wherein patient can get dialysis at their home.
Thank you for that wonderful and elaborate answer, Dr. Jeswani. Dr. Omar, would you like to add something to it?
No, not no. It's just, he did it so beautifully. I don't think there's anything to add to it. I can talk about kidney transplant if you would allow
Yeah,
me
yeah,
to,
we are
but
coming to that. Yes, yes.
so if you
After
want me to
dialysis
talk
अभी
about
तो transplant की बात तो होनी ही है.
सो प्राइमरली ये चीज़ है, किडनी ट्रांसप्लांट का मतलब है कि हम किसी और की किडनी लेके आपकी बॉडी में डाल देते हैं. अब वो एज पर लॉ इन इंडिया वो किडनी 3 तरह के लोगों के हो सकते हैं. इट इज रिलेटेड, लाइव रिलेटेड डोनर, मतलब कोई आपके रिश्तेदार हो, वाइफ, मदर, फादर, ग्रैंडफादर, और एक्सटेंडेड लिविंग रिलेटेड डोनर्स की क्राइटेरिया दूसरी होती है, या फिर कैडेवरिक डोनर हो, और फिर दूसरा तरीका होता है डोमिनो ट्रांसप्लांट जिसको बोलते हैं, या स्वैप ट्रांसप्लांट जिसको बोलते हैं, कि सम you are donating to somebody else's person and that person's relative is donating to you. तो वैसा कुछ उसको बोलते हैं swap transplant या domino transplant. So these are the 3 ways in which you can get a kidney from somebody else and transplant it into your body. किडनी ट्रांसप्लांट की सर्जरी काफ़ी एक्सटेंसिव सर्जरी होती है, 5-6 घंटे की होती है. इट इज़ वेरी स्पेशलाइज्ड प्रोसीजर, हर सेंटर में नहीं होती है. आपको पता करना पड़ेगा विच इज़ द नियरेस्ट सेंटर टू यू, एंड वहाँ पे आपको ले जाना पड़ेगा. उसकी प्रोसेसिंग टेक्स टाइम. माने जो भी आपका डोनर्स प्रोस्पेक्टिव डोनर हो उसका मैचिंग आपके साथ होना चाहिए, मतलब आपका खून का ग्रुप, उनका खून का ग्रुप मैच होना चाहिए, और भी सारे जो टिश्यू के वैल्यूज होते हैं वो भी मैच होने चाहिए, प्लस वो खुद हेल्दी होने चाहिए, मतलब उनका स्वास्थ्य ठीक होना चाहिए ताकि वो एक किडनी डोनेट करें. अब यहाँ पे मैं ये कहना चाहता हूँ कि डोनेटिंग अ किडनी इज अ लाइफ सेविंग थिंग. आपने किसी को अपनी जान दी, दैट्स अ वेरी गुड थिंग. और डोनर्स की लाइफ स्पैन, मतलब जितना उनकी एवरेज लाइफ स्पैन है, जितने वो साल किडनी डोनेट करने के बाद जिएंगे, एज पर लेटेस्ट स्टडीज इट्स ऑलमोस्ट नॉर्मल. 100% नॉर्मल नहीं है, लेकिन ऑलमोस्ट नॉर्मल है अगर वो अपना सेहत का ख्याल रखेंगे. किडनी ट्रांसप्लांट के बाद क्या फायदा है कि जो डॉक्टर जसवानी ने बताया आपसे कि डायलिसिस की जो तरीके होते हैं, यू आर अवे फ्रॉम दैट, मतलब वो सब आपके लिए खत्म हो जाते हैं. मतलब आपको डायलिसिस, एक सक्सेसफुल किडनी ट्रांसप्लांट के बाद डायलिसिस लेने की कोई ज़रूरत नहीं पड़ती है. आपको थोड़ी सी दवाई लेनी पड़ती है. अगर आपकी किस्मत अच्छी हो तो कुछ 5-10 साल के बाद वो दवाइयाँ भी बंद हो जाती हैं, बिकॉज आपकी बॉडी फिर उस किडनी को टॉलरेट कर पाती है. वो दवाइयाँ चलती रहेंगी, और आपको रेगुलरली 2-3 महीने पे आपको अपने डॉक्टर के साथ चेकअप करना पड़ेगा कि आप वेदर योर जो आपकी डोनेटेड किडनी है वो काम कर रही है या नहीं. लेकिन मेन चीज ये है, डोनेटिंग अ किडनी to a relative, or pledging to donate your kidney, god forbid if some untoward incident happens, is a great thing. We strongly recommend it because आप किसी की जान बचा रहे हैं. And living with one kidney is possible. मतलब ये नहीं है कि आपने एक किडनी दे दी तो आपका जान खत्म. आप आराम से अपनी नॉर्मल जिंदगी जी सकते हैं. थर्ड, transplant is in my view, and I'm sure in the view of Dr. Jaswani as well, it's a very good option as compared to having regular dialysis, चूंकि आप फिर डायलिसिस की हेडेक से बच जाते हैं, एंड यू मूव ऑन टू लिविंग एन ऑलमोस्ट नॉर्मल लाइफ. थैंक यू.
Yes, Dr. Jaswani, anything you
Yes.
want to say?
So kidney transplant, if I talk about kidney transplant, is like a second life to a patient of chronic kidney disease. Basically, kidney transplant आपके पूरे फिजियोलॉजी को बदल देता है. इट ट्राइज टू रिस्टोर द नॉर्मल फिजियोलॉजी. सिर्फ आपका क्रिएटिनिन और यूरिया क्लियरेंस ही नहीं ठीक होता, आपका हीमोग्लोबिन, जो हमारा किडनी है, वो एक बहुत इंपॉर्टेंट हार्मोन बनाता है जिसको कहते हैं इरेथ्रोपोइटिन. जो सीकेडी का पेशेंट होता है या जिसकी किडनी फेल हो जाती है, वो ये हार्मोन नहीं बना पाता, इसलिए इन पेशेंट्स को बार बार अनीमिया होता है, खून की कमी होती है. तो हमें डायलिसिस में ये इरेथ्रोपोइटिन के इंजेक्शन लगाने पड़ते हैं. इवन ट्रांसप्लांट से सिर्फ आपका यूरिया क्रिएटिनिन यूरिन ही ठीक नहीं होता, आपके ये बाकी पैरामीटर्स जैसे हीमोग्लोबिन बढ़ना, क्योंकि आपका नई किडनी भी इरेथ्रोपोइटिन बढ़ाती है. द सेकेंड थिंग इज योर मिनरल बोन डिजीज. हमारी किडनी जो है, विटामिन डी का एक बहुत इंपॉर्टेंट मेटाबॉलिज्म में रोल प्ले करता है. I have actually seen a lot of patients recovering from mineral bone disease, a lot of patients recovering from renal anemia post transplant. It absolutely changes your entire life. You can have a more better perspective, more positive perspective towards life. You can get back to your daily activities, your job, and have a normal life like anyone else. And as sir rightly, I would like to say, sir ने बहुत सही बात बोली donor के बारे में. You will be surprised to know a lot of people are actually born with one single kidney and they do not know until their lifetime. So living with one kidney is definitely possible. एंड किडनी डोनर जो होता है, उसकी पहले पूरी जांचें होती हैं कि कहीं एक किडनी देने से उसको नुकसान तो नहीं होगा. उसके किडनीज का स्प्लिट फंक्शन निकाला जाता है, उसकी किडनी की पूरी जांच होती है, और अगर सेफ होता है तो ही डोनर को इंकरेज किया जाता है किडनी ट्रांसप्लांट के लिए. तो डेफिनेटली डोनर हैज नो रिस्क एट ऑल. I have been very fortunate to have witnessed more than 1,000 transplants during my DM career. And I have to say, not even one donor had any issues in those time period.
Yeah, in fact, this joke goes around, right? That if you want to buy something related to Apple, you may need to donate or sell off one of your kidneys. So I think it is very clear in the common public कि एक kidney पे जिया जा सकता है. So
Yes,
But it depends
absolutely.
on which Apple product you want to buy. There
yeah,
are so
yeah,
many
yeah,
in the
I know.
market. Yeah.
अभी अभी 13 Pro लेने जाओगे तो शायद दोनों बेचनी पड़ेंगी नहीं.
Yeah.
So I have like two sudden queries popped up in my mind. Okay, so there is a question. How do we go about prostate screening if there is a family prostate cancer?
So I'll take that. Do
Yeah.
nothing till you are 50, because the age, we say 40 in African American males. We of course don't have that the group here, but do nothing till you are 50. At the age of 50, do a prostate screen. Prostate screen is very simple. Go to a urologist who will do a DRE. DRE is an examination of your prostate. One, two, you do a simple serum PSA. PSA stands for prostate specific antigen. It's a blood marker which is related to the prostate. And number three, just do a USG to see the size of the prostate so that everything can be correlated. पीएसए का एक टाइम मतलब बढ़ा हुआ रिपोर्ट निकलना is nothing alarming. I would just like to put this out in front of everyone. One report of PSA immediately, which is beyond the normal level, can have many reasons. Most common in our population is a chronic prostatic infection. Like we talked about UTIs earlier, patients can have UTIs which are undetected or ignored for many years, and then they can end up with having prostatic infection, which can cause an elevation in the PSA. So after you have screened yourself once at the age of 50, if it is normal, do nothing. Your urologist will tell you when you should be available, when you should come for the next screening. Usually it is after 2 years. At the age of 60, again you screen, and then screen annually, then so however long you want to screen yourself.
I think I would just add, I think Sir would agree with me. A lot of people, my personal experience being, I have had witnessed patients googling their symptoms, talking to quacks, getting some medications like Urimax, which is actually alpha blocker, thinking they have BPH, and actually one guy actually had a metastatic prostatic cancer. So I think it is always better. And the patient, he said, मुझे लगा कि prostate बढ़ गया होगा, उसके वजह से हो रहा है, मैं तो गोली भी खा रहा हूँ, मैं तो गोली भी खा रहा हूँ. But then when he came to me, he had bony mets. So I think definitely screening is very important. Every prostate problem is not BPH, which people
Correct.
think. So I think screening is
Correct.
very important from the correct person.
Unfortunately, we live in our system. Unfortunately, and I'm sure Dr. Jaswani will tell us from his training in Jaipur, and where I am and where I have trained in Maharashtra only, close to 98% of our patients in this country come with metastatic disease, metastatic prostatic CA. Close to. However, in the urban areas, it is changing, and mainly because of the point that Dr. Day has raised, that how do you screen for your prostate? Many patients are screening and they are being picked up at a very early stage. And luckily for us, they're ending up with urologists who are treating them properly. Otherwise, like Dr. Jaswani said, they can end up with people who do not treat them properly, and then they reach a stage where there's no point in the treatment.
Yes. So, yeah, I had two queries that suddenly popped up in my mind when we were talking about kidney transplant. So, once a healthy kidney is transplanted into the
Right.
recipient, yeah, so I was wondering if that patient was having chronic kidney disease because of, say, for example, diabetes or hypertension or autoimmune for that matter, wouldn't it start affecting the new kidney as well? Number one. And number two, can a transplant patient who is on immunosuppressants take COVID vaccination or any other vaccination?
Yeah, I'll take that. So
Please.
what you have said is actually very. I mean, I'm. I think it's amazing that you have actually thought of it. It is. I mean, it's quite a. I mean, important question.
Thank
which
you,
I
Dr.
think
Jaswani.
uh, it's called recurrence of primary disease in the transplanted kidney. So what there are few conditions which have a very high propensity of recurring in the transplanted kidney. For example, some form of glomerulonephritis. So I think what is very important is to know the native cause of the kidney disease. That is why when you do a kidney transplant, you want to be sure what was the reason in the first place that the first kidney went off. So the most important thing, I think the golden thing is doing a kidney biopsy. But our setup, we get a lot of patients in end stage renal disease where the kidneys are already 7 centimeters cortic. There's no cortex. You can't do a kidney biopsy. You just assume that there is some form of chronic glomerulonephritis. For example, you said a patient who is elderly, patient who is diabetic, hypertensive. You assume that the patient is having a diabetic kidney disease. So you usually diabetic kidney disease patients do not have recurrence of disease in the graft kidney. Usually, for the graft kidney to have a diabetic kidney disease per se would take 8 to 10 years, and the average survival of graft in India is around 10 to 12 years. There are few forms of glomerulonephritis which are very aggressive. For example, focal segmental glomerulosclerosis of one type is so bad that it would, once you do the transplant, probably the next day patient may have a recurrence of the focal segmental glomerulosclerosis. So if you do have a documented native biopsy, you want to look at the type of FSGS and then you decide about the biopsy. The other thing is HUS, hemolytic uremic syndrome. You want to do the full genetic testing before doing a transplant. You don't want to do a second transplant in such patients. So knowing the primary cause is extremely important. But per se, there are few glomerulonephritis which actually have a very good, which have very few chances of recurrence. For example, IgA nephropathy. India most very common is IgA nephropathy. IgA nephropathy usually does not recur 5 to 10 years. So giving a new life, a new graft 5 to 10 years is, I think, quite decent. The other thing is that you asked was about the vaccination. Each and every patient, let it be chronic kidney disease, let it be transplant or pre-transplant, has to undergo COVID vaccination. There is absolutely no contraindication. There is no contraindication on immunosuppressions. In fact, all the transplants that I'm doing at present, I encourage all my patients to get COVID vaccination first before going for a kidney transplant. So definitely, no contraindication for vaccination. If you're CKD, you're on dialysis, you're on peritoneal dialysis, you have a transplant, you're going to have a transplant, you need the vaccine.
Okay, so I think the answer is very clear. Okay. Uh, Lastly, if I talk about dialysis, because I think we missed some points there, as in, like, patients generally, I think they ask, ki, is dialysis very costly? Does it cause weakness? Also, they are scared of catching hospital borne infections like the nosocomial infections that we talk about. Obviously, because a dialysis machine में पूरा blood किसी का घूम रहा है and the patient is actually watching it. So I am sure that they are very scared with the fact that they may catch some infection. So then what are your answers to such patients?
Yes, so the thing is, I think you have to sometimes balance in life. What are the advantages, what are pros and cons? So, what I personally feel is, first, if we talk about cost of dialysis. Now, cost of dialysis is, if we talk about, I would say it's roughly, if I take an average, it's around 1,500 to 2,000 rupees per session. That will be around 4,000 rupees a week, which actually might not be suitable for pocket of a lot of people. But government has luckily given a lot of schemes now. In fact, I want to tell people that people who are actually not having a BPL card or not having a Ayushman card, they can also avail these facilities at private hospitals, which have a tie-up with the government to provide subsidized rates for dialysis, because it is a chronic disease. Patients need it for years. So I think it's a very good initiative, especially by the Maharashtra government has made a very very good initiative by the Mahatma Jyoti Phule scheme, and it is providing good quality dialysis. If I talk about the side effects or the risk of catching infections or patient apprehensions per se, I think yes, definitely, but I think it also varies from center to center. I have the second wave of COVID, which hit the Vidarbha region really bad in March, April. I remember we had to relocate all our, we were having roughly around, I think 15, 20 patients of dialysis every day. And we had to actually relocate because the entire facility had to be converted into a COVID center. And we had to overnight shift out the entire dialysis center to a place wherein it can be COVID safe. It can be safe for patients to come on OPD basis, get dialysis and go back home. So I think it depends on center to center, but definitely risk of infections, I would say yes, there is risk of infections in dialysis. But I think if you weigh the pros and cons, not getting a dialysis done is definitely more harmful. So definitely you need to get your dialysis done, and I think dialysis patients should be educated about how their dialysis is happening. A lot of things, small things in dialysis, like what is your ultrafiltration, machine में पानी कितना लगाना है, how much should be a weight gain between two dialysis, which is the interdialytic weight gain, what should your blood pressure be on dialysis. I think patients should be aware about it. That is, I think, very very important.
Okay. Dr. Omar, would you like to add something to his answer?
Not at all. Not at all.
Okay.
I can't add anything to this. What the beautiful things he has said. No.
Okay.
A
Okay.
urologist would never comment on dialysis.
Yeah.
He won't dare to comment on dialysis.
So I think unless and until we have any other question, the admin may flash those questions. But if we don't, I think we can wrap up the session with the last most important discussion, which both of you can contribute to. That is, let us talk about a few tips that can be given to people as to how they can keep their kidneys healthy.
Dr.
Okay,
Jiswani, I
so
think you take the lead.
so I think there is the first thing that comes to my mind is water intake. So there is no recommended criteria how much of water you should take, but approximately 8 glasses or 2 liters a day is decent amount of water. Keep hydrated. I think a lot of times we are working and we are really busy and we don't have a look how much of water intake we've done. So I think always carry your water bottle with you and always sip some water whenever you can. The other thing is, I think, very important for diabetics and hypertensives. I think always keep your blood pressure under control. Your target should be below 140 by 80. Your sugar should be under control. That is definitely a long term implication on your kidney disease. The other thing is, I think, to have a very active and positive attitude towards life. I think definitely prevention is better than cure, as we know. But I think having a positive perspective towards life and is definitely helps you to prevent chronic diseases. Dr.
I
Umar.
would just like to add two things regarding the water intake, just to make it more easier for patients to understand. So the recommendation is 8 glasses of clear fluids. So we cannot substitute water by coffee or tea or cold drinks. A clear fluid is defined as one in which if you keep it on a glass, a glass which is transparent, you can read through it. So that's a clear, and you should
Okay.
have
Okay.
eight glasses of that. So that can be like, for example, a light lime juice. That can be like, for example, some light juice which is like almost clear, or just plain water. So that's one thing. As far as urine is concerned, we recommend that the patient should have a light yellow color, or absolutely transparent color of urine is also not good, but a light yellow color of urine is recommended. That is shown to prevent dehydration and also shown to prevent migraine headaches, which is also a very common outcome of dehydration. So a light yellow colored urine is should be your target for the day whenever you pass urine, except the first urine in the morning. All other urines that you have passed in the day should be light yellow color, not dark yellow. Definitely.
All right. All right. what is fluid balance? What is the kidney's role in it?
So fluid balance is nothing but your positive and negative balance of fluid. So fluid balance, I think, is very important when we talk about patients of chronic kidney disease or acute kidney injury. Uh, so when you do give a certain amount of fluid, you expect the output to be sufficient enough not to cause a positive balance in the patient's body. Because if there will be positive balance, there would be swelling in the legs, there would be shortness of breath, there can be pulmonary congestion, lung congestion, and kidneys definitely have a major role in it. So what do kidneys do? Kidneys basically, they remove the extra water which your blood is filtering, and it removes it and it makes it into a fluid which is called as urine. So kidneys have the major role in your fluid balance, and there are a lot of conditions in which your fluid balance can go haywire when your kidneys are not functioning properly.
Okay. So I guess that was all to be discussed today. And obviously, one session regarding kidneys or the urinary system is not enough. So we'll try for some other session sometime. And I am very, very thankful to both of you for accepting my invitation and coming here as these knowledgeable speakers from whom I got to learn a lot of things myself. And I'm sure the audience also got to learn a lot of things, and a lot of their myths were cleared. So thank you very, very much. And I would like to wrap this session with this. Your closing comments, anything if you would like to say?
Dr. Jaswani, please.
I think it's a very good initiative that you have taken, Dr. Subi. What I would like to say is that uh, what we discussed initially, kidney disease is now a lifestyle disorder. As you check your blood pressure, as you check your sugars, heart checkup, I think kidneys are extremely important, and these are the vital organs which, if have irreversible damage, it can be very chronic and very debilitating. So I think take care of your kidneys. Early screening prevention is definitely better than cure. And thank you, Dr. Mitra, for giving us this opportunity. It was absolutely wonderful. Thank you, Dr. Omar.
Thank you, Dr. Jaswani. I'd just like to say just one thing. It costs nothing to check your urine. So if you
True.
have any problems in your urine, check it and show it to a responsible doctor. And thank you, Dr. Mitra, for this opportunity to speak to everyone through your platform.
Most welcome, most welcome. So let's wrap up the session. Would like to give my closing comments. So at Evrox Healthcare, we do care about whatever you have in your mind, be it psychiatric, psychological, medical, or surgical. So whatever the next session you want, please drop your comments and like, comment, and subscribe. Watch out for this space more and more for good content like this in the future as well. Our poster will flash again, and you have the telephone number and the website. So thank you very much for attending this session. Good night, everyone.
Good night.
Good night.